Okay, we're going to get started. Good afternoon, everyone, and welcome to the State of Vermont's Young Children and Families. My name is Dr. Morgan Crossman, and I am the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. I'm thrilled to be here this afternoon to talk you through the most up-to-date, high-quality data on children and families. So on an annual basis, Building Bright Futures produces the How Are Vermont's Young Children and Families report as a tool for legislators, policymakers, and invested leaders statewide, and really focuses on data-informed policy decisions. So thank you for joining me today. A couple of housekeeping items before we get started. All participants will be muted during the presentation, so if you are unmuted, please make sure your line is muted. Today's briefing will be recorded. Both the slides and the recording will be on the Building Bright Futures website. And as you're listening today, please feel free to submit questions or comments in the chat bar or hold your questions until the end of the presentation for a discussion period. I do want to ask that we keep this space productive and be sharing information and asking questions. And although we won't be able to accommodate all questions today, we will host that discussion at the end and are also happy to follow up and connect with you directly regarding any questions after the briefing. Next slide, please. So for today's agenda, we will open with brief remarks from Governor Scott. We'll outline a view of our collective vision for Vermont's young children and families, walk through some key data points that show us the current state of children and families, and provide an overview of the 2020 State Advisory Council recommendations. You'll also hear about the direct impact of the pandemic on children and families' mental health. You'll hear from a parent of a young child who's navigating our service system, and you'll hear from Vermont's Senate Pro Tem, Senator Balland, who will speak about the legislature's commitment to children and families this year. And finally, we'll conclude with remarks about Vermont's Early Childhood Action Plan and the soon-to-be-released Vermont Early Childhood Resource Data and Policy Center. It's now my pleasure to introduce Governor Phil Scott, who will spend a couple of minutes talking about his commitment to supporting children and families through pre-recorded remarks.
Thank you for inviting me to speak with you today. This annual report, How Are Vermont's Young Children, is a helpful tool for me and my team as we work to provide a good foundation for our kids. Our child care system has always been important for children and families, but this year we learned just how critical it was as families dealt with this once-in-a-century crisis. I want to recognize and thank the providers who stepped up from the very start. Since my first day in office, we recognize that early care and learning is so important and is directly related to a child's well-being, development, and academic success. That's why we've worked so hard to protect and grow this area. But over the last 10 months, we've come to better understand just how critical this work really is. Early on in the pandemic, working together, we made sure our child care centers could stay open, because we saw just how interconnected you are to the economy and how important you are to the families and kids you serve. We still have a lot of work to do to achieve the best cradle-to-career system in the country, but we know an integrated, equitable, accessible, and high-quality system will improve outcomes for each and every child from birth to adulthood. So thank you again for all your hard work and energy. I look forward to working with all of you and the legislature to make this happen.
So thank you to Governor Scott for his continued commitment to Vermont's children and families. And I do want to have a couple of key reminders before we get started. So as we're moving through today's presentation, you're going to hear me reference the field or stakeholders or we. And when I'm saying we, I'm talking about the collective we. I'm talking about early childhood leaders, including families, providers, educators, directors across the state of Vermont, and not just those that are integrated within our Bbf network, the Building Bright Futures network. We're talking about everyone who's engaged in supporting children and families across sectors. So to start today, I'd like to talk you through Vermont's collective vision for early childhood. So Vermont aspires to realize the promise of each and every Vermont child by ensuring that the early childhood system is an integrated, continuous, comprehensive, high-quality system of services that's equitable, accessible, and will improve outcomes for all children in the prenatal period to age 8 and their families. We have an incredible opportunity in many ways because of this update to Vermont's Early Childhood Action Plan, but also because of the pandemic, to really think hard about how we do our work and identify opportunities for improvement. And most importantly, how we build a seamless experience for families and break down silos to do our work more efficiently and collaboratively. So I'd like to ask everyone now to either turn off their cameras or close their eyes or focus on the photo that's represented on the screen here. And I'm going to walk you through a visualization exercise based on the vision that collectively Vermont's early childhood stakeholders have created through Vermont's Early Childhood Action Plan. In the year 2026, a child is born to a Vermont family. We'll call her baby Mariah. Vermont's a state where all children and families are accepted for who they are, and we support this child from the very start all the way through their development and education. This child thrives with the loving care of her parents and caregivers. Her family is safe and stable in their home and has food in their fridge today and on the horizon. Baby Mariah's parents use paid family leave and home visiting to support the physical and mental health of both parents and baby. The family is connected to their diverse community and can access services, resources, and the supports they need, including but not limited to high-quality childcare, a faith community, mental health support, healthy foods, and jobs. Mariah grows into a toddler, preschooler, and eventually transitions into a local elementary school. She's resilient to navigate even the most difficult days she will face. Mariah does not yet know that there's a community holding her and her family through a seamless system of support. This is a system where all children have a healthy start, where families and communities play a leading role in children's well-being, where families have access to high-quality opportunities that meet their needs, and where the early childhood system is integrated, well-resourced, and data-informed. This is the future. So please rejoin us and turn your cameras back on. And as we move through this morning or this afternoon, and we talk about the current status of children and families, I really want you to hold on to this vision and reflect on where we are now and where there are opportunities to move one step closer. To that vision. I'm also going to ask that folks, again, as a reminder, are muting themselves on the line. All right. Now that we've grounded ourselves in this vision, it's important to understand the role of the Building Bright Futures State Advisory Council and network in supporting that vision by using evidence to inform policy and raising awareness of the update to Vermont's Early Childhood Action Plan. Next slide, please. So what you're seeing here is the executive summaries of 3 different documents. On the left, you're seeing a one-pager that describes the role and the infrastructure of the Building Bright Futures Network. So for those of you who haven't been as engaged in this work in the past, Building Bright Futures is Vermont's early childhood public-private partnership that's mandated by Vermont's Act 104 and the Federal Head Start Act to serve as the State Advisory Council on Early Childhood. BBF's mission is to improve the well-being of each and every child and family in Vermont by using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. So within Act 104, BBF has 5 key mandates.
And if she's not nice to me, then nobody can ever help her.
Those 5 key mandates start by convening stakeholders to strategize and problem solve, to empower families and communities, to monitor the system of services and outcomes for children and families, responding to the emerging needs and gaps, and finally, to serve as the primary advisor to the governor and the legislature on the status of children and families. And the way we do this work is through a 300+ person network of both public and private early childhood stakeholders across 12 regional councils, 7 action plan committees, and the State Advisory Council. So our job here is to hold the vision and the strategic plan for Vermont's early childhood system, and then on an annual basis, produce this annual How Are Vermont's Young Children and Families report and present it through this briefing. In the center, you're seeing an executive summary of an 80-page needs assessment. So in this last year, in 2020, we conducted the Early Childhood Needs Assessment for the state of Vermont. And this is something that's a responsibility of the State Advisory Council every 5 years. And that document outlines the gaps, the barriers, and the challenges, as well as opportunities in our early childhood system. And this report is available on the BBF website as well. And finally, on the right, largely informed by the needs assessment, is the 2020 update to Vermont's Early Childhood Action Plan. And so again, this is serving as the state's vision and strategic plan supporting kids and families for the next 5 years. It articulates 4 key goals, as well as outcomes and indicators to monitor progress towards those goals. And I think it's important for everyone to know that this is a living plan, a living document that's adaptable to change based on the policy landscape and what's happening on the ground for kids and families. So relating to our vision for this system, it's important for us to understand where we are now and what to watch for in the future by reviewing data. So that leads us to the 2020 How Are Vermont's Young Children and Families report. So this report includes 5 state advisory council recommendations and a snapshot of the most up-to-date data on the well-being of kids and families. And in today's presentation, I want you to expect to hear so much information in a very short period of time. So please be referring to the report, the PDF of Vermont's Early Childhood Action Plan and the needs assessment, as well as the soon-to-be released center that you'll hear about more at the end of today's presentation. As always, more about each of these indicators can be found in the reference section of the report, and you can also feel free to reach out to data@buildingbrightfutures.org for more information. So today's briefing is going to focus on the challenges children and families face in the areas of basic needs, child development and education, and mental health. And those things will be presented both in light of the COVID-19 pandemic and challenges that have really predated our time. Not only has the pandemic impacted service provision, but it has and will continue to impact our data. So this year's report actually includes a COVID-19 data spotlight, highlighting that this data may actually be an outlier. And what that means is that it may not follow the existing trend or pattern that we've seen in the past. We're still reporting this data because it's critical that we use the most up-to-date information we have, but it's also important that as we move forward to watch how these trends and data may change in the next year, 3 years, or 5 years to understand the long-standing impact of the pandemic on outcomes and service provision for kids and families. It's also important to recognize that even before the pandemic, collecting, reporting, and accessing high-quality data was a challenge in Vermont. The 2020 Early Childhood Needs Assessment, for example, very clearly identified high-quality data as a significant need in the state of Vermont. And that's called out through an 8-page data gaps table that'll help us prioritize data moving forward. So as we talk through the data, what we hope you see is how each data point is related and that you see an interconnected system and that you're able to understand that there's a ripple effect by which when one part of our early childhood system is struggling, it impacts all of the others. And finally, that you understand the importance of cross-sector collaboration and integration as key to improving outcomes for children and families. Next slide, please. So to jump into the data, I want to start with a snapshot of data from the COVID-19 spotlight. So as I mentioned, the COVID-19 pandemic has really challenged the strength and resilience of families, communities, and our entire early childhood system. So we've seen inequities are greater for children and families who are living in rural areas, the BIPOC community, non-native English speakers, those with lesser incomes, and then children with special healthcare needs. So this first slide presents data from Feeding America on food insecurity for children under the age of 18 in Vermont by county. So it's comparing 2018 actual percentages to 2020 projected percentages. And those projections are based on the Map the Meal Gap modeling strategy. So essentially they're able to use a modeling strategy to make national and local level estimates of food insecurity using unemployment and poverty rates. So what you're seeing in this bar chart is that there's an increase in the percent of kids who are food insecure across every single region of our state. This data was updated in October, and even since, we've seen an increase in food insecurity according to the US Census Pulse surveys and the utilization of food-related resources. So we all know that meeting children's basic needs is so critical to all other areas of their development. Without proper nutrition, children aren't able to learn and develop and grow and thrive like we outlined in our vision. Additionally, the stress of being unable to meet the physiological needs like food, shelter, also impacts the ability of parents and families and caregivers to create an opportunity, an environment where children can thrive. But Vermont has prioritized supporting the basic needs of children and families. And there are several food programs during the pandemic, like the Everyone Eats program and the federal Farmers to Families food box program. And then more broadly, across our early childhood system, we've seen support from 3 Squares, the SNAP program, and then school meal programs. I also want to point out that our partners at Hunger Free Vermont and the Vermont Food Bank are closely monitoring the rise in food insecurity in Vermont, and they are really working to meet the changing needs of Vermonters. They actually presented a briefing last month that included additional in-depth information on Vermont's response during the pandemic. So if you're interested in hearing more, I highly suggest that you take a look at their data and their briefing as well. The next slide is about safety and stability of Vermont's children and families. So this slide is showing some really interesting data on family support calls from 2 different perspectives. The first is focusing on the calls to Vermont's DCF Child Protection Hotline, and the other is on families who are reaching out for support. So figure 3 is showing a snapshot of weekly calls to the Child Protection Hotline in Vermont. And this is a comparison looking at the calls during the period of March through May 2019, and that's represented in the orange. The calls during that same period in 2020 are represented in hot pink. And so what you're seeing is that there were so many more calls to child protection hotlines during this same period in 2019 than there are in 2020. So what happened during this period? This was the period in Vermont where we were in a stay home, stay safe order starting in March, alongside the closure of childcares and schools. And with many children not participating in their traditional care and community settings, what we're seeing is that there were likely mandated reporters not having contact or eyes on children to monitor the safety or report potential abuse or neglect. And that same trend of a reduction in calls to child protection hotlines is in line with what we're hearing from other states across the country during the pandemic. This does not mean that there aren't just as many cases of abuse and neglect happening, and it's just that they may be going unreported. And this is particularly concerning given the stress and isolation families have faced. So the second indicator on this slide is the drastic increase in the percent of calls to Help Me Grow Vermont's 211. So between May and June 2020, 211 saw an increase in 600% in the families reaching out for support. And that was largely in the areas of food resources, trying to meet other basic needs, and calls for problem solving and listening support. So again, families are struggling through this pandemic, and while they have demonstrated resilience, and we've seen public and private partners really step up to meet their needs, we cannot underestimate the impact that this pandemic is having on the health, mental health, and well-being of Vermont's children and families. I do want to point out that it's also, it's not necessarily correlated, this data, to an increase in utilization of supports. Next slide, please. So in this year's report, we have highlighted the integrated continuum of child development and education from the prenatal period through age 8. So what you're seeing in this slide is a new visual that we've created to show part of that continuum. And really what we're focused on is what families have access to when we're talking about child development and education outcomes. And it's important for those of you who aren't always as integrated into the early childhood system that we do have an incredibly robust, but also complex early childhood system. And this visual does not capture everything. It's a starting point though, for our partners to see some of the visual representation of what's available when children age, where there may be appropriate overlap in those services and systems, and then the transitions we may see or gaps in service provision. What this visual also shows is the importance of integration and continuity of service provision for families, because our goal is seamless navigation of services from the perspective of families. So at the bottom, what you're seeing is a call out to Vermont's Early Childhood Action Plan in Goal 4, where our vision is for the system, again, to be integrated, well-resourced, and data informed. Next slide, please. So I'd like to start this section talking about childcare, which has received so much attention statewide and on the national stage during this pandemic, and for good reason. There's so much evidence out there on the importance of high quality childcare for young children and families. And that's not just with respect to child development outcomes, but it's also the ability of families to work and to keep our economy moving. Childcare settings are also places in which children and families are able to access a range of other services and resources. For example, early intervention, special education for our preschool children, the opportunity to make connections to nutrition support, and for providers and educators to be making connections and identifying concerns in child development. So what you're seeing on this slide is pre-COVID data from the 2020 Stalled at the Start report from Let's Grow Kids, which shows us that of the children likely to need care, 62% of infants, 27% of toddlers, and 30% of preschool age children don't have access to full day, full year regulated childcare. And that's a lot of children and families who don't have access to what they need. And the COVID pandemic has really only complicated the dire struggle to secure high quality, affordable childcare for our youngest and most vulnerable children and their families. And in that area, we've seen programs have to reduce capacity or hours in order to really meet the safety guidelines. We also know that Vermont's leaders have been really concerned about gaps widening in access to childcare. So we've seen an investment of over $40 million to help stabilize and sustain childcare and early educators as essential. It's also really important to note the changes in or challenges in our data infrastructure. So when I say infrastructure, I'm talking about our systems that are in place to collect and report data and our ability to truly understand childcare demand, capacity, and enrollment. So what we know is the Vermont's early childhood databases are really inadequate in providing a full picture of service provision and how that relates to child and family outcomes. There's a lot of work to be done in this area, and the State Advisory Council has prioritized evolving our data systems to address those gaps. We've all recognized that strong cross-sector data linkages are going to be what allows decision makers to understand the long-term impact and a return on investment for early childhood services. And that's in addition to how we improve right now the resources, services, and supports for our young children and families. Next slide, please. This next section focuses on outcomes of child development and education assessments. And measuring child development and educational outcomes really helps inform service delivery, how to design and improve programs, services, and resources. And in Vermont, we currently report 3 primary indicators to measure a child's knowledge, skills, and behavior. The first is Teaching Strategies Gold, the Agency of Education's Ready for Kindergarten survey, and 3rd grade math and reading. One of the challenges with educational outcomes, though, for these young children is that they are difficult to measure in the early childhood period, and folks see them as very subjective. So we're going to start by looking at Teaching Strategies Gold, which is an assessment for 3- and 4-year-olds in pre-K. And this is collected through teacher observation and assessment, or educator report. This is something that's collected twice a year in Vermont, and it's required by all Act 166 providers. So again, thinking about publicly funded pre-kindergarten education, or what we call universal pre-K. So in the 2018-2019 school year, 85% or more of students who were assessed met or exceeded expectations across literacy, math, and social emotional domains for both 3- and 4-year-olds. Next slide. The Agency of Education's Ready for Kindergarten survey is a readiness assessment that really looks at a kindergartner's knowledge and skills within the first 6 to 10 weeks of school. So kindergarten teachers assess students on 34 items across 5 different domains. So what we saw is last fall, 84% of Vermont's children assessed were ready for kindergarten. However, it's really important for folks to realize that our readiness rates are they vary based on race, economic status, and other factors of vulnerability. And one thing that's not represented here is the trend over time. So there has not been noteworthy change over time or improvement in since 2015 in the percent of children who are ready for kindergarten. Next slide, please. And finally, at the end of 3rd grade, Vermont students are assessed on their proficiency in reading and math. So why is 3rd grade math and reading proficiency important? What we know is that this is an indicator, and this series of indicators are really the foundation for lifelong learning and success. So children who are skilled in reading often perform better in school. They attain higher levels of education or experience lower rates of disease. They may be less likely to be incarcerated or experience poverty, more likely to find employment, and achieve higher incomes as adults compared to children who fail to achieve that reading proficiency. So here's what we know. Of all students assessed in 3rd grade, 50% are proficient in reading and 53% are proficient in math. And similarly to the data that I just presented on Ready for K, there has not been noteworthy change since the 2015-16 school year. And then those proficiency rates are significantly varying by race, economic status, and other vulnerability factors. Next slide, please. So we want to put these up on the screen all together, and these assessments are not directly comparable, but it's still important for us to look across these three indicators and see where there's opportunities for improvement. So especially in light of this expected setbacks from the pandemic. There's striking differences between the assessments at ages 3 to 5 and those at 8, which has really prompted Vermont's leaders, including Governor Scott, the Secretary of Education, and members of our State Advisory Council to pay closer attention to this data and look for opportunities for improvement. So we can absolutely anticipate a focus on literacy in the next several years, and the governor has started to articulate his cradle to career vision. So within the Building Great Futures Network, we are committed to this data, and we've actually put together a small team that's working to develop formal policy recommendations in this area as well. But this is an indicator that we want to be watching in the future. Next slide, please. Now we're going to transition to talk a little bit more broadly about what we know about the mental health of children and families. So in reviewing the most updated data pre-COVID, 1 in 5 children between the ages of 6 to 8 had a behavioral, emotional, or mental health condition. So take a moment to think about how the pandemic has impacted our kids and families. There have been so many transitions, right? So it may have been the closure or reopening of childcare, the different models of education, hybrid and remote learning, or other gaps that we just saw widening in the rates of food insecurity. For me, this mental health statistic may be one of the most critical indicators to watch in the coming years to understand how the pandemic has impacted the mental health of our children across all ages, and then consequently how we need to adjust our practices across settings and ages to meet their needs. Next slide, please. This next indicator is the number of children under 9 who are served by Vermont designated mental health agencies. So this visual shows a fairly consistent number of children served between 2016 and 2020, but over time, we've seen an increase since 2000. And again, it's important to point out that the 2020 data may be an outlier. So the timing of and reporting of data like this is important and may not always be reflective of the actual number of children served based on the reporting cycle. So it's also not reflective necessarily of the anecdotal evidence we've all heard across the state for the need in the last 9 months for supporting the mental health of not just children, but families, educators, providers. The early childhood and family mental health focus was really already a priority of Vermont State Advisory Council, and in that last year developed a mental health task force that resulted in a report and recommendations, which are now even more important given the pandemic. So that is something you can also find on the Building Bright Futures website. Next slide, please. So moving away from some of the data, but based on that data that you've heard today, and based on data from the Early Childhood Needs Assessment and priorities and gaps identified by the Building Bright Futures Network across regions and at the state level, the following State Advisory Council recommendations were formally adopted. Recognizing Vermont's early care and education system and workforce as essential, mitigating COVID's impact on family economic stability and mental health, recognizing chronic inequities and racism as a public health crisis, empowering family voice to rebuild a stronger system, and evolving our data system to address gaps. So within the How Are Vermont's Young Children and Families report, there's one full page dedicated to each of these topic areas with information on why it's important, the concrete recommendations, and then strategies for how to move that work forward. And all of these things are very much aligned with Vermont's Early Childhood Action Plan. So we will continue to focus on COVID-19 and the mental health as we start to talk more about the 2020 recommendations on this topic. So just to give you a quick snapshot of what we had in the mental health arena for recommendations, the first was to mitigate the health and economic effects of the pandemic on families and to sustain and strengthen the integration of mental health services for children and families through flexible funding for integrated mental health across settings. And so again, this full recommendation can be found on page 8 of the report. And we're excited next to hear more about early childhood and family mental health as a catalyst for change in our system. So I'm going to turn it over to Cheryl Wilcox, who is the public co-chair of our State Advisory Council.
Thank you so much, Morgan. I'm looking to the faces on the screen to see if my audio is working and everyone can hear me okay. Wonderful. The nodding heads is really helpful. So when Morgan and I talked about this, I won't have slides for you. There's information that you can see, but it's a nice opportunity for us to look at each other and see who's here. I absolutely want to thank Building Bright Futures for continuing to shine a spotlight on the importance of health. I will say at the Department of Mental Health, our mission is to promote and improve the health of Vermonters, and we don't separate physical and mental health. They go hand in hand. We know how much they interact with each other, and that it's incredibly important that we are paying attention to that. So I know you all just saw that one of the recommendations from Building Bright Futures is to sustain and strengthen the integration of mental health services for children and families through flexible funding. And DMH could not agree more with this goal. And despite this challenging year, we have seen some amazing things happen with flexibility, like telehealth. So either during virtual like this, where we can see and hear, or even for folks that don't have the internet, as we don't have it everywhere strongly in Vermont, who can talk on the phone, that's being reimbursed and supported. And it's been really important for families to still access services. We know that even though we have mental health staff that are dealing with their own stresses and own challenges, often doing their own parenting at home or caring for others, they've continued to be committed to this work and are showing up to keep supporting families. I feel really lucky in Vermont, which is where I am raising my children, that we recently ranked #1 overall for mental health access in the nation. And so that is something that I'm happy to provide more information about. It's very much based on how well children and families can access services. That is not to say that we think we have arrived and have solved everything. We know that there's more to do to strengthen this. We know that in Vermont and also nationwide, it's clear this pandemic has had a two-pronged effect on mental health services. So first, it meant that people seeking services because they were staying home and staying safe decreased. So we knew more folks, and know from the data more folks are accessing telehealth, but we also know that there were periods of time when everyone was staying home and staying safe, and so there weren't as many folks reaching out for a period of time. We also know that there are adults, and we know that adults are often the caregivers or parents of children and our young Vermonters, who have sought out mental health services who never had before. So one of the things we've definitely seen is folks who may have challenges but have really maintained and been okay are reaching out for support because this has been challenging. And then folks who already were struggling are having a harder time, which completely makes sense. And we want to make sure our mental health system is strong. So when we think about children and our young children, it gets more complicated in our picture. And that's because schools closed or did hybrid models. We know that families were faced with supporting their child's learning at home, often, again, without internet access or strong internet access, and then getting services when they could through telehealth. We also know our providers were challenged with the same issues in their workforce. So we've had staff who were also trying to provide support to their children at home, or who may have health issues and weren't able to work. So even with folks staying home and staying safe, which was the right thing to do, this fiscal year, so the school year of 2019 to 2020, our school-based mental health services, we saw 3,656 students statewide. And when we look deeper at this data, this is a 13% increase compared to prior school years, and the greatest number served in school mental health services in the past 10 years. We looked even deeper to see how many of those children were under 9, and it was 880 students, which is about 24% of all children served in school-based mental health were under 9. So I will say we have had incredibly strong partnership with the Agency of Education and Department of Mental Health, who together joins to help support school-based mental health services, and we're continuing to look to see how we can strengthen that. Another thing we have been hearing about is children and youth experiencing increased stress and anxiety because of the pandemic. So we are incredibly thankful in our mental health system to have programs like our crisis support through our mental health agencies. There's also an innovative program, Pediatric Urgent Care for Kids, that's down in Bennington. And the goal of these programs is to make sure families are being supported in crisis so that we can make sure not as many children are going to emergency departments, which is not where we want children going when they're having mental health challenges. We want them supported outside of the hospital. So we've been able to see that these programs have helped decrease the number of children going to emergency departments. Another piece that Morgan talked about was showing the number of children served by our mental health agencies. And so she showed the basically consistent level. And then in this past year, there was a decrease of 151 children served by mental health agencies. And that is still, we know, it's a small amount of decrease, and that still is with the last few months of last year when schools were not in session and people weren't reaching out as much. So we're paying attention to that. We also have been tracking how many children under 9 received support through our crisis services. And in fiscal year 19, we saw 265 children in those programs. So this past year, there were 227, which is 38 fewer. Again, we're not sure exactly what that's going to mean. It looks like we're making progress, and yet we know people were staying home. And so that's data, as Morgan said, we're going to be tracking closely. We know that for some children and families who didn't have access to remote services, those who needed direct support, our agency staff did really creative things. So this summer, they set up big tents outside and also used large indoor rec spaces so they could still be seeing children and families. I know there were deliveries made by mental health agencies of care packages or food or other activities. And so it's been really great to see the creativeness that folks have done during this time when they couldn't have people coming in and seeing them in their office for safety reasons. Another thing the Department of Mental Health has been doing to support early childhood and family mental health in collaboration with our Department of Health is something called a STAMP grant. And so STAMP stands for Screening, Treatment, and Access for Mothers and Perinatal Partners Grant. So it's a 5-year federal grant, and perinatal refers to pregnancy through the first year of infancy. The grant, which was established a couple years ago, is really to be able to support women who experience depression and anxiety during this time period. What we know is 1 in 5 women experience that. And so there have been a number of trainings with health providers and others saying how important it is to pay attention to this, to make sure that we're getting support to women, because it absolutely is treatable and can be improved. So just during this pandemic time, 130 providers received virtual training. I will say one of the things we have been really happy about that we hope does not change is in our virtual world, we can reach so many more people. And my guess is many of you have been a part of statewide meetings where all of a sudden we have lots of people that before, when we had to travel hours from one end of the state to the other, we may not have been able to do. So it's something that has definitely been a positive of all this. I would close by sharing a story about one of my favorite people, who is Ellie. She's 4. And her mom and I have been very dear friends a long time, and actually raised, we have older kids that we raised together, and she very bravely became a parent again 4 years ago. So she has a 4-year-old and 2-year-old. And so this has been my one family, my one safe family through all of this, that we've gotten together outside and have done things. And so 2 weekends ago, we met up to go skiing. And I will say I'm a new downhill skier. I didn't grow up in Vermont. I grew up in warmer climates and always avoided it because I am so afraid of heights. So it was a foggy day on the mountain. So also the first run, I was up there, couldn't really see where I was going. I was already nervous, made it down, taking lots of deep breaths, got to the bottom. It's when my friend and Ellie showed up. And so Ellie, who's 4, who's already almost a better skier than me, rode the chairlift in front of me. So she was with her mom, my friend, and we were headed up just to the midway point. And we reached the part where the fog started rolling in, and it was getting really cloudy, which was making me nervous. And I was sitting alone in my chairlift while Ellie and her mom were in front of me, and I was breathing. And Ellie turned around full of excitement and yelled, "Cheryl, we're going into the clouds," with the most excited amazement. And I thought, okay, take a breath and try to make this something that is exciting and fun, and keep in mind, we all have light at the end of the tunnel. It's been hard to see where we're going, but I feel like the connections and the support we provide each other is really getting us there. Thank you so much, Morgan, for letting me speak to mental health. I appreciate it.
Thank you so much, Cheryl. It's really nice to hear the personal connection, but also to hear about the innovation that we're seeing and cross-sector collaboration. So thank you so much. So next, I want to transition to one of our parent leaders, Lexi Duquette, to be talking more about her family's experience navigating the pandemic and our service system. Thanks for being here, Lexi.
Hi, thank you. Is volume okay? Can you guys hear me?
Yes, you're great.
Okay, perfect. It is such an honor to be here today to speak as a Vermont family and on behalf of the numerous other local families I've spoken with as a parent ambassador for Building Bright Futures Vermont. My name is Alexis Duquette, and I reside in Putney, Vermont with my husband and our 4 children, 12, 6, 4, and 15 months. Parenting is hard enough. Add a pandemic and everything else that is going on right now in our world, and it's truly the perfect storm. This pandemic has added so many more challenges that it's hard to prioritize which to tackle and address first. There will always be the affordable and available child care issue, which is definitely heightened even more so in this new normal. There is even more serious intensification of all challenges now. Some of the most common challenges for the local families that I had spoken with in my work with Building Bright Futures in this survey include internet and connectivity issues, lack of childcare, along with affordability, isolation, increasing mental health issues, job insecurity, and financial struggles, just to name a few of the many. There are so many unknowns and tough decisions parents have to make. For example, to choose remote versus homeschool versus sending them to school. Plus, how do you answer your children's questions and comfort them when you don't even know the answers? My family's biggest struggle personally started at the very beginning of COVID. It was the lack of internet access to our home. We couldn't get anything that was suitable for streaming. Our only solutions ended up being either A, mobile home school setup, which was meant to drive to either the local library or school, park, entertain a toddler, while 3 others attempted to Zoom in a small car, all together, all at the same time. Really wasn't the best long-term solution. Or B, we can use our hotspots on our phones, which only can handle 1 Zoom at a time. Then it was the decision, who gets to Zoom today? Once we hit our so-called unlimited data limit, which usually ends up by the 2nd week of the month, we are then onto even slower internet, more connectivity issues, and even more charges on our bill. This has truly been a full-time job in itself. The next big challenge for our family was that whole work versus school issue. A full-time job with only a 2-day school week, then our daycare didn't reopen the classroom our baby was supposed to go into. So it wasn't my choice. The final factor was COVID deciding for us that I'm not returning to work. After spending a whole year prior planning to return to the workforce, I was a little devastated. All of these things and more weigh on parents' mind. Everyone is trying their best to navigate through this unprecedented time the best they can. I personally knew I needed a parent support group, something to not feel so alone during these times. My work through Building Bright Future Vermont has helped me reach out to numerous local families all over Vermont. And the one thing everyone could agree was peer support is needed. Vermont families need to be seen and heard in order to be felt, in order to feel and be supported. A chance to share challenges, successes, and not feel so alone and isolated during these times. If only the technology aspect could actually cover everybody, so people could at least connect from the comfort and safety of their own homes, would really help support one another's mental health during this time. I truly believe it takes a village to raise a child. That's the very reason we chose Vermont to raise our family. Even though our state has been doing a great job and the people are really stepping up, I still believe we need to stay diligent and one step ahead of our local families' needs. I believe that it is our beautiful state and the incredible caring people in it that will be able to overcome and adapt to this new normal so that our families can continue to grow and thrive to provide a solid foundation for our children's futures. Thank you.
Thank you so much, Lexi. It's so important for us as leadership across the state of Vermont to be grounding ourselves in the experience of families. And so I just want to say a very quick thank you and shout out to the Families and Communities Committee and our parent ambassadors, 22 parent ambassadors who came on board and have been working for Building Bright Futures in the last year, doing incredible work to elevate the voice of families. So thank you so much, Lexi, for representing that group today.
Thank you.
So next, we're going to hear from Senator Becca Balland to hear about the legislature's commitment to supporting kids and families. Senator.
Good afternoon. Can everybody hear me okay?
Yes.
Okay. For those of you who don't know me, I'm Senator Becca Balland from Windham County, and I'm the President Pro Tem of the Senate. And I'm really happy to be here with all of you for the release of Building Bright Futures 2020 report. You know, we all want the same things. We want a prosperous Vermont economy. We want a vibrant and innovative workforce. And we want and we need healthy communities and families. And that all starts with ensuring the healthy development of our youngest children. And the Bbf Advisory Council plays the important role of monitoring the well-being of our children and our families. This critical public-private partnership advises the legislature. This is an important role for all of us. It advises us on the status of our most precious resource, and that, of course, is Vermont's children. And the report has a really important function. It brings policymakers like me and general Vermonters out in our communities up to speed as to where we're succeeding and where we still have further work left to do. Now, I'm speaking to you today as a senator and as the new President Pro Tem, but I'm also here as a mom of 2 young kids and as a former teacher. And I've taught in 3 different public schools in Windham County. And all over my neighborhood, my town, and my county, I run into my former students. They are now adults, living, working, and contributing to the social, the cultural, and the economic health of our communities. Educators and parents literally help to grow our future. And when we as legislators partner with educators and parents and have a solid set of data on which to build a legislative conversation, that's when we can do our best work. So one of the things I really appreciate about the work of BBF is that it's grounded in and driven by data. And this data empowers legislators with the knowledge that we need to communicate effectively with our constituents and our colleagues and to pass policies that best support Vermont's families. You know, and data is a way to ensure that we, as representatives of the people, and that's something we all take really, really seriously, that we're accurately representing our people back home and acting with their best interests in mind. Now, when I was a teacher, we had a special time set aside each week to discuss our students who were really struggling. And we started with stories and anecdotes and observations from teachers and staff and parents. But then we determined what data we needed to gather in order to make the best decisions about what each student needed in order to be successful. Our decisions were informed by stories, but grounded in data, and both are incredibly important. And similarly, the important work that BBF does, includes all these really important data points that will help inform us as we head into this session. I just wanted to highlight one important example of this. So when you look at the data that is provided to us around food insecurity, there is so much that we can learn about our families, our communities from that section of the report. We have rising rates of Vermont children and families who are food insecure. Of course, it's absolutely devastating. It's something that we all care about so deeply. And this challenge was highlighted in both the COVID-19 spotlight of the report and also in this section on how are we meeting basic needs of our children and families. There have been many, many statewide initiatives to support nutrition and food security for all Vermonters. And of course, there were even more of those initiatives during and continuing through the COVID-19 pandemic. And we know, based on the data in this report, that this needs to continue. This is still an immediate need that so many children and families are facing. Now, I'm trained as a historian. That's what I did before I was a legislator. I taught history at many different levels. I did historical research. So being trained as a historian, I know how long social and cultural change takes. I understand both the long arc of history as well as the urgency that moves us towards change. And I just want to make explicit for all of us here that our accomplishments regarding the health and welfare of Vermont's young people, these things don't happen by accident. They happen as a result of planning and collaboration between many folks, including many of you who are on this call right now. And I know I speak for so many of my colleagues when I say that we recognize the critical importance of careful planning, of using data, and as the speaker before me said, listening directly to our constituents to truly understand the experiences that they're going through. So we'll use this data and we'll couple it with a strong vision of the future that we want for all Vermont's children and families. Then it will be up to all of us to plan on how we get there, how we'll get there together. Vermont's Early Childhood Action Plan provides a strong vision and critical action steps that will take us there if we have the courage and the commitment to do that. Obviously, I don't need to tell all of you on the call. We know that the pandemic has created many, many additional challenges for families around the state. It certainly has for me, as I see my connectivity going in and out, and my daughter's on Zoom in the next room. Earlier today, I actually had a meeting and she had her glockenspiel lesson at her through Zoom for school, and my internet quit out a little bit as she was Zooming on that. So I get it on that basic level. But this pandemic has highlighted the inequalities, the inequities, all the gaps in our system. And responding to the immediate needs and setting a foundation for long-term recovery and growth has to be a priority this session. So I want to leave you with this. We can and we must make Vermont a place where young children can thrive and that families can afford to live and work. This focus is good for all of us, regardless of socioeconomic status or geographic location. Healthy families make for strong, supportive communities. And we all know that strengthening our state's early care, our health, and our education systems are key to realizing that vibrant vision for our future. And so I know that our work can be daunting at times, but we can't lose heart. We can't lose our focus or determination because Vermont's children are absolutely counting on us. Thank you.
Thank you so much, Senator Balland. I love that what I heard you say is the importance of qualitative stories from families, and families are so critical to this equation. And we forget sometimes when we talk about data that it's not just a number. It's not just the numbers that we've shared on the screen today. It's the stories. It's the qualitative accounts from families and providers and educators on the ground that are going to show us how we move this work forward. So thank you so much for being here today. Okay. So in our concluding remarks, you've heard so much today about data, gaps, challenges, successes, the impact of the pandemic on data gaps and outcomes for children and families. We've touched on some of the State Advisory Council's recommendations. You've heard perspectives from parents and legislators, as well as our agency leadership. And so as we finish our time together today, and I know we only have a few minutes left, I want to invite you to go to the chat bar and share a little bit about what you've learned from the state of Vermont's young children and families and how you plan to use this report in decision-making moving forward. So as of right now, the chat bar is open, and I'm inviting you to share your reflections there. And we will try to take a couple of minutes at the end to have a couple of questions and discussion. So we're going to go back to our slide share for just a minute. Looking forward, Building Bright Futures will continue to monitor service provision and outcomes for children and families. And we want you to know exactly where to go for additional information. So the Building Bright Futures website is a really great resource. And later this month, we will be launching Vermont's Early Childhood Resource Data and Policy Center. So this new center will be a collaboration between the Building Bright Futures team, researchers from the University of Vermont, as well as state agency partners. And we are all recommitting to using evidence and data to inform policy and service provision in this next year. And what we've heard so clearly is a call to create this center in 2020 for a centralized one-stop shop for stakeholders to view the latest data, resources, and policy recommendations within Vermont's early childhood system. So when this center goes live later this month, on there you will see a catalog of high quality resources for families, communities, and early childhood professionals. You'll see data from both national and Vermont specific data sets, the related policy briefs and recommendations from the State Advisory Council, and for the first time, data from the state longitudinal data system that's overseen by our Agency of Education, which is really, really exciting. Another key component of this site is a data dashboard that, again, for the first time ever, we are identifying indicators and monitoring outcomes associated with the goals, the 4 goals that we've identified in Vermont's Early Childhood Action Plan. The center will also have reports, publications from both BBF, but also our community and agency partners statewide. It'll have recorded research presentations, webinars, and the start of early childhood grand rounds coming later this spring. And then finally, it'll have a portal for stakeholders to ask questions about existing data, make recommendations for data that's needed, and then report data gaps and priorities. So we're going to stop our screen share. And in closing, we know we still have a lot of work to do. And we already know that Vermont is an incredible place for children and families to thrive. So for those of you who don't know my background, I've been trying to move back to my home state of Vermont for the past 7 years to raise my now 3.5-year-old daughter, who is in childcare as we speak. And I see some of the providers on, so it's nice to see you folks on the call as well. But we know there's still gaps in service provision for some families, and that there's a longitudinal impact of those children not receiving services during early childhood. So it's critical that all of us this afternoon, as leaders, decision makers, families across the state, really reaffirm our commitment to early childhood and improving the well-being of children and families in the state of Vermont. We need to commit to using evidence and data to inform decision making and really, again, step outside of our individual silos, right? So we need to recognize value each part of our system. Everybody's role is critical to ensuring optimal outcomes and really moving towards this unified vision for the early childhood system. So I want to take a minute to thank my guests for joining me today. So Lexi Duquette, thank you so much for being here. Cheryl Wilcox, Senator Balland, and Governor Scott. I also want to acknowledge the many partners who made this report and briefing possible. So again, this is a collaborative effort. This data is from across so many different partners. I want to start by saying thank you to National Life, our corporate sponsor, and a grant from the state of Vermont. And I'd also like to thank our state agency and community data stewards, the State Advisory Council, Vermont Early Childhood Action Plan committee leadership, and most importantly, the families who are sharing their stories and the photos that we've used for this report. And then finally, thank you to my team at Building Bright Futures. I want to thank everybody on the call for your commitment to Vermont's children and families. All right, so we're going to go to our chat bar, and I really appreciate folks being vulnerable and sharing a little bit about what you've learned, what you're excited about, and where you see promise, and how you'll use this report in the future. So I do want to open the door to say, we're happy to answer questions or hear comments about what we've discussed today. You can put your questions into the chat bar. And there are definitely going to be questions because we are already at time that we are not going to be able to get to. So we are happy to both connect folks with the appropriate data stored if there are questions about the data that we may not be able to answer, but also to hold this space open a little bit longer after we're done recording to make sure that folks are able to engage with this data a little bit more. So I'm going to turn it to Dora and Beth. So Beth Trzanski is our Deputy Director at Building Bright Futures, and Dora Levinson is our Data and Policy Director to facilitate some of the questions and discussion based on what they're seeing in the chat.
Awesome. Thanks, Morgan. One of the questions that we received, I will read it to you, is in the governor's opening remarks and in his inaugural address, he spoke about his cradle to career vision and housing the child development work under all under one agency. I wonder if you can comment on this or provide more insight.
What a great question. So here's what I can say. Governor Scott has been talking for quite some time about this cradle to career vision. And I'm really excited to hear that the administration has a formal plan for what that may look like and how they're going to implement that vision, and that we will see that information coming in the next month or so. But we have formally invited Secretary French, Secretary Smith, and the DCF Commissioner Brown to clearly articulate this vision at the February State Advisory Council meeting. And so just as a reminder to everyone, this is a meeting that's open to the public. So we invite you to attend, to learn more about this vision, and to participate in the discussion about what we see as some of the major challenges, barriers, concerns, but also where there are opportunities to implement that vision. So thank you for that question. And just as a quick note, that is the February SAC is on the 22nd. And for all the folks that are attending this meeting, we will make sure that you receive an invitation there as well.
The next question that's come in is that about the slide that you shared around the continuum of supports, and wondered if you can talk about the gaps in services and transitions across the early childhood system.
Sure. That slide is such a passion of mine. And, when we look at this visual there, what we know is that we have a very robust system, right? We have so many resources, services, and supports for families to access. And that transitioning between those can be really challenging for families. So what we wanted to do was show you all, here's a snapshot. Here's what happens over time as children age. Here's where there's overlap. Here's where there's potential for gaps or challenging transitions. So what I will say is that within the last year, the Building Bright Futures Network has really prioritized family engagement and partnering with families to really understand their perspectives on things like transitions. So you heard Lexi talk a little bit about a parent-led survey and report that was just published that came out with data on families' experiences transitioning in our system. And the statistic that stands out the most to me is that only 52% of families strongly agreed that staff have made every effort to understand their needs and the needs of their children as they are before and after and during this transition. So essentially what that tells me is we have so much more work to do to streamline this system of services. So yes, we are providing comprehensive services, but how can we best support seamless transition for families, recognizing that from the family's perspective, they aren't feeling like their needs are prioritized necessarily in the ways that we need to. The other thing I think it's important to articulate is when I'm looking at this continuum of services from a data perspective, I'm seeing that we've made great strides in our early childhood system. So one of the things that Building Bright Futures has been doing in the background is collaborating with the Agency of Education to compile and then disseminate data from the state longitudinal data system. And so for the first time, Vermont was able to produce an unduplicated count of children across a range of programs that you're seeing in that visual. But the more exciting part to me is that we actually can now look at the count of children who are both accessing Head Start and Early Head Start, as well as early intervention and special education services. So that is so exciting to hear that data will be publicly available later this month through Vermont's Early Childhood Resource Data and Policy Center. But overall, I do think that folks are really starting to understand what our early childhood continuum of services looks like and how it impacts kids and families. I do think what's really important on that slide is to recognize that, again, it is just talking about what we know about child development and education and not bringing in all of those other services and resources and supports that we're talking about when we say the early childhood system, like mental health, nutrition, children's integrated services, family support services. There are so many other areas that we are really focusing on. So I think let's take one more question and then we will leave the lines open for a couple of minutes once the recording is finished.
So Morgan, another question has come in on food security. Notice the breakdown by county and wondering if there's statewide, the statewide number is available.
That's a great question. I think one of the things that I'd like to do here is highlight the work of some of our partners at Hunger Free Vermont and others who are really focusing on food security as their primary issue. What we've seen is that depending on what data source that you're accessing, there are differing numbers. So what we've tried to show you here is that across the entire state, there's variability in food insecurity, but that we've seen a massive rise in food insecurity in the last year or in the last 2 years. The rates that we provided in the basic needs section of the report does show that 1 in 7 children were food insecure. But again, that data is prior to the pandemic. So I'd like you to go to the most up-to-date resource for food insecurity. Okay, so I really appreciate everyone coming today. We are a little bit over time already, but I do want to close and say, what we know is that ensuring that each and every child has what they need to thrive and succeed in early life sets the foundation for life course outcomes for that child. And it also sets, a healthy economy and community on track. It's really critical for us to continue to monitor and evaluate Vermont's early childhood system and child and family outcomes so that we can understand the impact of policies, programs, and decisions and really ensure that our children and families' needs are being met. So I really hope that this report inspires you to evaluate our work together to improve the lives of children and families in Vermont, because what we know is our children are our future and the future is bright. Thank you for being here today, everyone.